Noticed that our government is in turmoil. We're leaving Europe, but we're not quite sure when and where. So it's quite nice to be away from all that stuff at the moment. We've only got about 10 days to go and nobody knows what's happening. So I'm a public health social scientist, and I did a lot of work from the late 1980s onwards, 1990s, on harm reduction for drug users, where we first discovered HIV infection in the UK and many other countries. And so I did a lot of research. In fact, some of my research team is still active in this area and have links with researchers here in Nairobi. And so I helped develop the idea of harm reduction with the UK government. I helped to develop it, to encourage other people to adopt harm reduction and help to evaluate it. So I'm a kind of card-carrying harm reductionist. And when I first heard about e-cigarettes and snus and so on, I thought, well, this is obvious. You know, you can take all the ideas for how we deal with sexual health and drug use, all those ideas about safer sex, even words like safer drug use, and now we've got safer nicotine products. And I thought that most of my public health colleagues would share my enthusiasm, but of course, as you know, this has become a very fraught and a very political field. So it's not plain sailing, but there's a lot of interest in tobacco harm reduction. And that's really where the GSTHR report, I'm sorry it's got such a long name, the Global State of Tobacco Harm Reduction, but we were observing these major changes in the way in which people were consuming nicotine over the last 10 years or so. So tobacco consumption, smoking dropping in many countries, and the rise of these new products, and of course the rise of some of the more long-standing products like snus. So something was going on. There was a big consumer interest in these new products. Shift away from burning stuff to non-combustible products. Now that has major implications for tobacco producers, countries producing tobacco, growing tobacco, has implications for tobacco companies, because all those companies making cigarettes suddenly get a bit scared when they see people switching from cigarettes to products made by other manufacturers. And also implications for consumers, because now there are ways of having nicotine without all the hazards associated with smoking. And with all of this, potential to reduce risk of disease and premature death. So what the Global State of Tobacco Harm Reduction does, it's a biannual report, and it's a stock take of who is using safer nicotine products, stock take of the regulatory response, and also an analysis of the public health potential. As well as the report itself, there is a website for the Global State. The report is translated into Mandarin, but there are also shorter summaries now in about a dozen languages. And there's an interactive website where you can click and you can pick any country in the world, and there you've got smoking statistics, e-cigarette regulations, snus, heat not burn products. So we've got country profiles. So we hope it will become an important resource. The context for all of this is smoking. Smoking is not a good idea, especially if you do it for a long time, and many people will die prematurely from smoking-related diseases. WHO estimates 6 million people a year die from smoking. And all the time I'm talking about smoking, a lot of tobacco controllers talk about tobacco as causing death, but smoking is the issue. It's a problem for poorer countries and for poorer people in richer countries. So the majority of the deaths are occurring in lower middle income countries, and in richer countries it's the poor who suffer most from smoking. So more people in fact die globally from smoking cigarettes than from malaria, HIV and TB combined. We often think of those three as big threats, and of course in some countries they are the biggest threats, but globally smoking kills more. And WHO estimates that by the end of the century 1 billion people will have suffered a smoking-related disease. It's about men in many countries, no, not just with smoking, but lots of other problems as well. But in Kenya, smoking is much higher amongst men than amongst women, over 2 million daily smokers, And different estimates of the number of deaths. Joseph mentioned 10,000 deaths. There are different estimates. One we've got at the moment is 6,250, but I think it's on the low side given the number of smokers and the population size. Interestingly, and we might be able to pick up in this later, there's quite a lot of smokeless use according to the survey data. 4% of men and 3% of women, and I'd be interested to know what that is. Compared with the health investments for the big health problems, there's very little money going into trying to persuade people not to smoke. The problem is that the latest data I could get from WHO was for 2007 with about 45K $1,000 going into smoking prevention, compared with the big funding from the Global Fund and others into HIV, malaria, TB prevention and so on, about $1 billion cumulative invested in Kenya to fight those major diseases. And of course that's a big health burden, and there have been major successes in driving down transmission and providing treatment. Smoking is predicted to rise in many African countries. Decline in Kenya, but these are figures from our report, but they're taken from WHO, which show projected increases in daily smoking prevalence across many countries in Africa. In fact, globally, the number of smokers is increasing as part of population trends, but also in some countries with increasing affluence in income, more disposable income, more people are starting to smoke. It's a problem because burning vegetable matter wrapped up in paper is not good for your lungs and other bits of your body. So the problem is combustion. And that connection between why people smoke, what happens when you combust tobacco, and nicotine was first made by a colleague of mine, Mike Russell, back in the 1970s. And this is often, this is a key kind of slogan really to understand in tobacco harm reduction, that people smoke for the nicotine. They like nicotine, they're dependent on it, they don't want to do without it, but they die from the tars and the gases and the other stuff that's being inhaled. About 7,000 chemicals in tobacco smoke, 250 or more are harmful, and at least nearly 70 are known to cause cancer. So the cigarette, the rolled cigarette, which was invented in the 1880s, is a very dirty nicotine delivery system. So Mike Russell and others started to think about what happens if you could deliver nicotine in a safer way. And there was quite a prescient report from the UK Royal College of Physicians in 2007. And this was before there were many safer nicotine products available, apart from snus in Sweden and nicotine replacement therapy, gums and patches and so on in the UK. That's before, just about the time e-cigarettes started to come on the market, but before they were very well known. Cigarettes were described to me by a government official as a heritage product, like champagne, or the cigarette in Indonesia has a strong flavouring of cloves, and they talk about it as it's part of Indonesian culture, and there's no awareness of risk to smoking. Many people, as I said, like smoking and like nicotine. Some people give up smoking on their own, self-will, or with medicinal products like nicotine replacement therapy. So that's like your doctor saying, I'll give you this treatment, but there's a 95% failure rate. Now that is just not good enough. We need to do better. Nicotine replacement therapy products, snus, e-cigarettes, heat not burn products, smokers and chewing tobaccos are down there as lower. And on the right-hand side, the high-risk products. Cigarettes right at the top, lower for cigars, lower for pipes. The advent of e-cigarettes as safer alternatives to smoking has been subject to considerable analysis of the evidence by Public Health England, and that's the research, the peak public health body, advisory body in England. And this has been mentioned already on the slide that Kevin showed. The assessment from the evidence is that e-cigarettes, use of e-cigarettes or vaping is at least 95% less harmful than smoking and of negligible risk to bystanders. So if I'm vaping, which I don't, you're not going to be suffering from the vapor, which if I'm smoking, you may well be. And there's now 30 or more years of studying the evidence for snus with big epidemiological studies, cohorts of Swedes being followed for many, many years, and it's really hard to find harmful health effects associated with diabetes, pancreatic cancers, heart disease or stroke. So considerable evidence, which we refer to in the report about the safety of alternative nicotine products. And since the introduction of these devices in Japan, there's been a 27% fall in tobacco sales. Never seen anywhere before. It's a dramatic drop in cigarette sales because in Japan the heat-not-burn tobacco devices have become very popular. Interestingly, in Japan, e-cigarettes are banned, and that might be part of the reason for the popularity of the heat-not-burn devices. In Norway, the rise in the use of snus, and I'll show you a slide in a minute, amongst young women has almost seen smoking disappear amongst young women. 1%, that's almost gone. In Sweden, snus has replaced smoking, and Sweden has the lowest level of smoking in Europe and the lowest level of smoking-related deaths. And in the UK, we've seen in the period since e-cigarettes have become popular, a rapid increase in the use of e-cigarettes and a rapid drop in smoking. Just to illustrate this briefly, these are two slides, two graphs from Norway. So if you look at the one on the left, the top red line is daily smoking in Norway, and you can see that dropping from 21% of the adult population in 2008 down to 11% of the population by 2017. So smoking started to drop, but you can see in the same period you've got the rise in the use of snus, the blue line, from 6% up to 12%. So this crossover and other evidence indicates that Norwegians are choosing to use snus rather than to smoke. And on the right-hand side, you've got this dramatic change for young women under the age of 25, 17% smokers in 2008, dropping to 1%. Huge changes, not seen before. You see that they're using snus, and overall the number of people using nicotine is stayed about the same, but they've switched from using it in cigarettes to using it in this safer product called snus. Just startling evidence of change. In the UK, now vaping started, it's been consumer driven. The UK government didn't encourage it when it started, it didn't discourage it. And in fact, you see around the world that most of these things have taken off without any government support and sometimes with government antipathy. There is now considerable support in the UK from Department of Health and from Public Health England. And so there's a very positive environment for e-cigarettes. We're probably the most e-cigarette friendly country in the world at the moment. So we're doing bad on Brexit, but quite good on encouraging people to use safer products. So here, this month, February rather, Public Health England statement, an opportunity to reduce the harms caused by tobacco by encouraging more smokers to try vaping and for dual users to switch completely. Dual users meaning people are smoking but also vaping. So we have a very positive environment for tobacco harm reduction as part of the panoply of tobacco control interventions. And we have high taxes, we have warning signs on packs, we have graphic diseases on tobacco, on cigarette packs, we have bans on underage sales and so on. The little poster on the right just shows you how far we've come, because we've had a very wide spread accessibility to smoking cessation services run by the National Health Service. And in fact, they've been losing customers over the last few years because people have been doing it themselves using e-cigarettes. But this is a poster from a very innovative stop smoking service in Leicester, which now has integrated e-cigarettes into the stop smoking service. So you can see this poster, you go around, you see this billboard, on bus stops and so on. It's time to switch, and you can't read it. If you don't think you'll ever want to stop smoking, think about switching to vaping. So, NHS message. And what is happening, I'm sorry these slides are a little bit dense, but you can see them in the report. On the left, the blue blocks are the percentage of adult smokers in the population, dropping from nearly 20% in 2012, when e-cigarettes were taken off, down to 15%, so we've got a decline in the number of smokers, and the percentage of the population using e-cigarettes is now 6%, 6% of the adult population using e-cigarettes. It's not 6% of smokers, 6% of the adult population are using e-cigarettes. It amounts to around 3.2 million e-cig users, of whom half are no longer smoking at all. So it's a significant public health intervention, but it didn't happen by public health telling people to do this. That's one of the fascinating things about this, because I come from public health where we're used to kind of telling people what to, or not telling people, but advising people what to do, and smiling as we're advising them, and encouraging them to, eat less fatty foods, drink less soda drinks, and cut out smoking. But of course people don't listen to us that much. But this wasn't as a result of a government initiative, this was a result of consumers adopting these e-cigarettes. And if you said you were going to launch a public health campaign, and within 6 to 8 years you're going to have 3 million people who adopted it, in fact more who adopted it, not will continue doing it, you wouldn't have been believed. They'd have said this is not possible. So sometimes good things happen without government. And that's difficult for me as a public health person to say, because we think that we lead rather than people leading. And on the right here, again, it's a rather dense graph, but the little red line, the weedy red line that's going down, how did they do it? So the red line at the top going down is nicotine replacement therapy, and the blue line going up is e-cigarettes. So you can see that of smokers who attempted to quit, 39, nearly 40% were using e-cigarettes on their last quit attempt. So they're not using nicotine replacement therapy, they're not, the other things are a little bit level, but there's a huge switch over. So it's a do-it-yourself approach to smoking cessation. And you might say, well, does it matter? Does it translate into health changes? And it certainly does, because Sweden has the lowest death rate from tobacco for men. And these are data from the World Health Organization. And you can see that the death rate per 100,000 attributable to tobacco, Sweden is right there, 152, and you've got countries near the bottom of this graph which are 3-4 times higher death rates. So switching to safer products, so Sweden is the best evidence for the impact on health. There are two themes, a theme, a major theme running through the report that, to me, I don't know, many of you have worked in the field of public health, but there's a document called the Ottawa Charter on Health Promotion, which is about enabling people. It's also, we don't have, I think, government officials here, but there is something called the Framework Convention on Tobacco Control, to which Kenya is a signatory. This is the International Convention on Tobacco. And the words harm reduction are there in the Framework Convention on Tobacco Control. Not many people from WHO or from tobacco control will tell you that, but the definition of tobacco control is reducing demand, reducing supply, and harm reduction. It's there. The words are there. There's another principle, I won't go into it too much now, but it's in the report that I see access to safer nicotine products as a right, part of the right to health. That if these products exist, you should be able to get them. And then it's unethical to deny people access. If a smoker is smoking, it's unethical not to give them access to something which is a much safer alternative to smoking. So just the last couple of slides now, an assessment of, I think, what's running through the report is that these products can replace smoking, and in the right conditions it can happen very quickly. That it's happened mainly without government initiative. It's sometimes happened in the context of governments not supporting it. So in Sweden, the government is not supportive of snus, but the Swedish population kind of know is good news for governments because it doesn't cost them anything. What other area in health or in public health could you say this can be done without you having to invest lots of money, without you having to go to Gates or Bloomberg or UK Department for International Development to get money for big projects? Because often in public health, you saw that side where I had the Global Fund investment in Kenya, $1 billion to fight AIDS, tuberculosis and malaria. Important money. But it's consumers putting their hand in their pockets and choosing to spend the money on safer products rather than on cigarettes. Don't panic. Some countries have banned. Some countries have legacy bans where the legislation existed before the products were introduced. Some countries have introduced bans. Don't obstruct access. Raise awareness for smokers that it's safe to use a non-combustible product. It's the smoke that kills. A risk proportionate response. Tobacco control wants to do away with tobacco and often nicotine as well, but some ways of using tobacco are much riskier than others. So it's stupid to do anything which would, if you ban e-cigarettes, for example, you're favouring cigarettes, because cigarettes are there. Yes. And you say, want to ban these new things that are coming along, and that's just daft, because you've got easy access to cigarettes. Encourage national production of safer nicotine products, and this was a discussion we were having in Malawi about the potential to shift from tobacco mainly for export, but possibly tobacco for local manufacture of snus, about which I'll explain more in a moment. And finally, encourage standards. Well, most of the questions that governments will have or consumers might have can be dealt with at a regulatory level. If you're worried about advertising, you can control that by advertising regulations. So in the UK, the Code of Advertising Practice has also covers e-cigarettes. So many, and if you're worried about children, and perhaps that will come up a bit later, because at least there's a big moral panic in the United States at the moment about e-cigarettes. That can be dealt with in very simple, well, in fairly straightforward ways, not bans on sales to underage people, but you might say, does that make sense? But I think in the UK we've probably discouraged youth use by making it, in the public mind, a product for older smokers. So it is not that kind of fashionable amongst young people, because this has been pitched for helping older smokers get off smoking. So, what we can do with that.